With the escalation of climate change, characterized by increasingly severe heat waves, scientists are delving into the intricate relationship between certain medications and the human body's ability to regulate temperature. The evidence of rising temperatures is undeniable. Projections suggest that heat waves will become more prolonged, intense, and frequent in the years to come. Already, escalating temperatures are manifesting adverse effects on human health. A recent report from the U.S. Centers for Disease Control and Prevention, CDC, revealed a significant surge in heat-related emergency room visits during the months from May to September 2023, compared to previous years. Moreover, mounting research indicates that individuals reliant on specific medications, notably including antipsychotics, may face heightened susceptibility to heat-related ailments and adverse reactions as temperatures soar. Numerous studies have elucidated that individuals with chronic conditions such as schizophrenia, diabetes, and cardiovascular or respiratory ailments are generally more prone to heat stress. Alarmingly, the medications prescribed to manage these conditions can exacerbate these risks. A study published in 2020 in PLOS One unveiled that various commonly prescribed drugs impede the body's capacity to detect and shield itself from heat, thereby escalating the likelihood of hospitalization. Among these medications are diuretics, antipsychotics, beta blockers, stimulants, antihypertensives, and anticholinergic drugs, encompassing medications for Parkinson's disease and bladder control. Additionally, the misuse of substances such as amphetamines and certain unlicensed weight loss drugs like dinitrophenol can disrupt body temperature regulation. Adam Blumenberg, an assistant professor of emergency medicine at Columbia University Medical Center, highlights the array of medications that impede the body's ability to dissipate heat, potentially leading to drug-induced hyperthermia. Although emergency room visits due to medication-related heat stress or illness are still relatively uncommon, Blumenberg anticipates a surge in such cases as heat waves and extreme temperatures become more prevalent. The human body employs a sophisticated thermoregulatory system to maintain an internal temperature within a narrow range. Blumenberg explains that deviations from this range, particularly temperatures exceeding 104 degrees Fahrenheit, 40 degrees Celsius, can pose life-threatening risks. The hypothalamus, a region of the brain, orchestrates mechanisms to stabilize core temperature in response to external heat stress. Through the autonomic nervous system, the hypothalamus modulates vital physiological processes such as heart rate, blood pressure, and respiration, while also regulating sweating and vasodilation to dissipate heat. Moreover, it prompts sensations of discomfort, prompting individuals to seek cooling measures such as shade, water, or rest. Experts underscore the role of anticholinergic medications in exacerbating heat sensitivity. These drugs hinder the action of acetylcholine, a neurotransmitter crucial for autonomic nervous system function, including thermoregulation via perspiration. Vicki Ellingrad, Dean of the University of Michigan College of Pharmacy, elucidates that anticholinergics can lead to reduced perspiration, dry mouth, urinary retention, flushed skin, dilated pupils, and altered mental states. Notably, even medications primarily targeting other receptors, such as certain allergy medications, can exhibit anticholinergic effects. Moreover, some antipsychotics and neuroleptics can induce heat sensitivity, potentially by blocking dopamine receptors, resulting in adverse effects on motivation, memory, and muscle function. Combining antipsychotics with anticholinergic drugs further disrupts thermoregulation. For instance, individuals prescribed haloperidol for schizophrenia may also receive benztropine to mitigate adverse effects, although this combination can occasionally elevate internal temperature. While advancements in psychiatric treatments have mitigated some adverse effects, responses to medications remain variable. Ellingrad emphasizes the inter-individual variability in the extent of acetylcholine receptor blockade, even within the same drug class. Consequently, careful consideration of medication choice and dosage adjustments is paramount, particularly during heat waves. Research published in the European Journal of Clinical Pharmacology in 2023 underscored that medications affecting the nervous and immune systems are most implicated in heat-related adverse effects. Furthermore, individuals on cardiovascular medications, such as beta blockers and antiplatelet drugs, face heightened risks during heat exposure. Beta blockers, for instance, diminish heart rate and skin blood flow, rendering individuals more susceptible to heat stress. Kai Chen, an assistant professor at the Yale School of Public Health, highlights the enhanced vulnerability of individuals taking certain medications during heat waves. While his study, based on a small cohort, warrants further investigation in larger populations, it underscores the imperative for physicians to consider medication-induced heat effects during heat waves. Soko Setoguchi, a professor at Rutgers Robert Wood Johnson Medical School, underscores the need for comprehensive research to elucidate the influence of extreme heat on medication interactions. She emphasizes the importance of individualized approaches, given the variability in heat sensitivity and medication responses. While some medications may induce heat-related side effects, they remain essential for managing various conditions. Experts advocate for open dialogue between patients and healthcare providers to optimize medication regimens and mitigate risks during heat waves. Additionally, individuals taking medications prone to anticholinergic effects should adopt cooling strategies such as hydration, shade-seeking, and air conditioning to safeguard against heat-related complications. As research endeavors continue, clinicians and patients alike must remain vigilant to adapt strategies and prescriptions to mitigate the evolving risks posed by climate change-induced heat waves.